Yeah, my name is Reinhold Schmieding. I'm President and Founder of Arthrex. I'm pleased to welcome Dr. Neal ElAttrache to our Studio 360 here at Arthrex. Thank you for joining us, Neal.
It's great to be here as always, Reinhold.
Neal, you've had an unbelievable season. You know, you've been team physician for the Los Angeles Rams all the way to the Super Bowl. You were also team physician for the Dodgers, got to the World Series. And this year, you're AOSSM president. It's quite a year. Can you tell us how you feel about your accomplishments and how you got to this point?
In many ways, it's a dream come true on all three of those fronts. Academically, with my participation and role with AOSSM, it's something that really I could never have dreamed that I would be able to participate in that kind of way and contribute in that kind of way. But I'm very honored to be able to be in a leadership role of that great society. And as far as the teams go, good care of those teams takes teams and takes teams of professionals. So I'm indebted to the great training staffs we had for both of those teams and a team of physicians that I put together and that supported me in doing it. There's no way I could have done any one of those things, let alone all three at the same time. And I know we're going to get into it a little bit, at least I hope we will, is the role that our relationship has played in all three of those things. It'll be 25 years ago next month that we personally met, and it was a few years before that I became exposed to some of the products that all that long ago that you were making here in Naples and in Germany. And my association with you and with this company is integrally related to the success I've had in my career, treating patients and staying at the edge of innovation with you. And in a lot of ways, I wish I had a championship ring to give you because in some ways you deserve one. But my thanks is going to have to do for now. But hopefully we'll get into some of those details.
So Neal, we really have a wonderful history together. 25 years ago we met, and we were always very impressed with your accomplishments as a physician, your contributions to science and medicine, to education, to research, and as an innovator in shoulder surgery. And became one of my early mentors. And together, we've worked together to develop great products and techniques that have really kind of changed the game for shoulder surgery. 25 years ago, we were a very small company, but you did recognize obviously something about Arthrex that was different, and seemed to be attracted by the private nature of our company, the fact that we're really focused on surgeons and their patients, and not economic return on investment like publicly traded companies. Can you remember back then, what attracted you to working with me and Arthrex?
Yeah, the great thing when I was early in my career and just trying to do my job every day, and at those times early on, my mentors in surgery, Frank Jobe and Bob Kurland and the other surgeons at the Kurland Jobe Clinic were allowing me and encouraging me to do things in the operating room at a very young age. And so I was encountering, just like any surgeons were at that stage, some of the challenges that you would have in the operating room, especially with what we were trying to do with the athletic population and decrease surgical morbidity, be very detailed. And everything we were trying to do was to get these guys back to either getting an education, playing the sport, or making a living. And I was being put in situations where we were sort of pushing the envelope and moving forward and trying to do things in this minimally invasive manner. And then along comes some of the people that you were involved with Arthrex in our area and on the West Coast, and then I had the good fortune of meeting you at the Academy meeting way back when, and 25 years ago, as I said. And the approach resonated with me. I had no experience with being, a colleague of somebody that was a manufacturer making products or whatever, but the approach really was important to me, and it was, what issues are you having? Where do you think we need to go? What is an impediment from keeping you to get from where you are right now to where you want to be and do things surgically? How can I help you solve some of these things? And tell me about what you're doing. And that's the approach. And so, with those common goals in mind, to be able to treat patients better, and especially because I had such a need for somebody that would listen to my little ideas or my issues or my problems or challenges and to help me solve them. It was very gratifying, very comforting to me. And so our relationship, I don't know if I ever verbalized it to you, what that meant to me from you and from Arthrex, but it was at a time that really helped shape my career in many ways. And so that approach, though, as I see it over the decades, has never changed. Even today, with the market success that Arthrex has had worldwide, that the approach to helping surgeons solve surgical challenges and push innovation forward and keep on improving every day, that's why surgeons are so drawn to you and to this company. So hats off to you for keeping up with your mission.
Neal, I remember fondly the day you came to visit Arthrex 2 decades ago, and you presented a problem to us. You wanted to place a graft into a socket to reconstruct the UCL in a very efficient manner. And you showed us a little handmade prototype of a K-wire and a little plastic fork on the end of it where you could push the tendon into the socket, right? And then over that screw, you could insert a screw that would provide a fixation of the graft, right? And that was really a significant step forward in orthopedic surgery. We designed the tenodesis screw system together, and that led to other devices where you put not just the graft, but also the suture into a hole first, and then you had fixation, and it led to most of our knotless fixation devices today. So it was really a significant day. So what did you learn from that experience, and what would you recommend other surgeons that have ideas, to do with them in regards to coming to a company like Arthrex?
Well, I have to say I had a much tougher time in those days than all these great surgeons these days. I had to audition. Quite frankly, the first meeting of that kind was you came out to see if anything I was doing was worth anything, and as far as if I could do anything in the operating room. And that was actually our first few days together, was when you came out to visit. But based on that, then I did get the invitation to come down, and it was a in my mind, a rather simple concept, but one that hadn't been solved. And how do you drill what we call a blind socket with no exit, and get tissue or suture to stay in there, and then deploy? At that point, we were using a threaded device, what we called the tenodesis screw. But the whole story about that and how that then developed is a typical story of what happens here. You take a problem, you have an idea, and you work on it and refine it, and all of a sudden it has uses that you never dreamed when you set out. All I had was my little issue, and never stopped to think this is going to revolutionize many of the common procedures we do. And likewise, I don't think that you did that envisioning that either. I don't think that Arthrex went about that thinking, okay, let's pencil this out and see how this is going to work financially. I had a challenge. You listened to what I wanted to try as a solution. You guys helped me refine it, and it became something that we could all use. And so it's just been a recurring theme.
Well, that's really the power of engineers, scientists, and surgeons working together. It's obviously surgeons present medical problems to us, and we're creative thinkers or engineers. We know how to solve problems, right? It's the combination of that together that makes things happen. So that's really been the foundation of the 13,000 products that we've developed over the last 37 years, 1,700 new products last year, and 2,000 new products in the pipeline this year that we will bring to orthopedics, in the next 12 months.
This is why when you have that kind of interaction, it's more like colleagues. We're collegial. We had a goal in mind, working together. It's not like some nameless, faceless industry working with some surgeon that we're somehow on opposite sides of the table or opposite sides of the issue. It's not that way at all. And no matter how governmental forces or whatever makes it seem, we're both going at it from a scientific perspective, working together to solve problems, and I think that's the most fruitful type of relationship. The integrity and everything else is in our DNA. We can figure all that out and make sure that we're doing things for the right reasons and doing things in the right way. But it's that collegiality that really produces this kind of success.
So you've mentioned to me a number of times that technology innovation has played a significant role in you returning your players to the field mid-season, particularly this last year or year before. Can you talk about the relevance of emerging technology and how that's changed your ability to keep your players on the field?
Yeah, it's very interesting. The physician-patient relationship with what's best for the patient, whether he's a player or not, that trumps everything. And that has continued, and so we constantly are trying to provide them with the best scientifically supported techniques and products that we can use. From a team perspective, when we look at what does that mean, there are specific instances where that has made a big impact on the success of the team. When these players are in the middle of their season and they are injured in the middle of the season, the ability to get them back that season may make or break the outcome of that team. My job as a surgeon from a team perspective, in addition to taking great care of the players and doing what's best for them, is if I can help them field the team that the coaches and the team designed in the beginning, then I've done my job. So the healthier I can keep them, or if they get hurt, the quicker I can get them back, give them the team at the end of the season that they designed at the beginning, then I've done something. Well, this year, and for the past 2 years, we went to 2 consecutive World Series with the Dodgers. There's multiple instances where guys in spring training or during the season were injured. We were able to do things that we have developed here, techniques and with implants that wouldn't have been possible to do. Getting them back during that season to make an impact to get us through the playoffs and into the World Series. We did our job with that. This year with the Rams, we had players that got injured mid-season, 2 of which were big impact players, one of which it's been shown that our team is 10 points better with that player on the field than not on the field, and was injured mid-season, operated on with double tight ropes for high ankle injury, came back in the season, and otherwise with this particular injury would not have come back this season and may never have been the same if you tackled this thing chronically. But because of the things that we worked on here, able to get him back. And when your team's 10 points better with that player on the field, that's really saying something. So very excited about being able to translate what we do here to success as a team physician.
So Arthrex is very committed to developing less invasive treatments, for athletes. What are some of the technologies or some of the procedures that you see coming that you're most excited about?
I think that with these guys, the surgical morbidity is always an issue, and so being able to do delicate repairs, accurate repairs with less and less invasiveness is always going to be the direction that we're going. We're never going to go the other way. And with the advent of the nanoscope, with a scope that has the technology that you can get a broad field of view with nothing bigger than a needle that can be put into the joint or elsewhere in the body, the uses for that are going to eclipse what originally was envisioned for the use of the arthroscope itself. So if you look back when the arthroscope was first developed, would anybody have really envisioned what was going to happen decades later and what we're able to do now? This is going to be, you're going to have to completely think in a completely different box with regard to using the nanoscope. It's going to get you places where you've never been able to go before, and it's almost like the joint's never going to have known that anything was there. That in conjunction with Ortho Biologics, to be able to modify the biologic aspects of healing That's going to be what's going to really influence what we do now for the next couple decades.
So Neal, this year you're the AOSSM president. Again, congratulations. How do you envision your relationship with Arthrex providing benefit to the society and its members this year?
From an educational research standpoint, which are two of the main pillars of AOSSM, we can't do anything without the support of people like you and companies like Arthrex. And Arthrex has been there as a major supporter for research and education for AOSSM and its members for years. And so we owe you a big thanks for continuing to support those endeavors. And it's annual, and it's multiple times a year that you participate that way. And so we're very grateful for that. Specifically, some of the new initiatives that we've been able to offer to our membership helps us to move to what the future is going to demand that we do as physicians following our patients. And patient outcomes have always been critically important. Codman near the turn of the century said, that this is what people need to be doing. They need to have registries. They need to be following their patients, following their outcomes. Otherwise, we never advance. We never have any scientific basis for changing and for getting better. And so the exposure to our membership of SOS, which is one of the most robust, if not the most robust, patient outcome systems today, to offer that to our membership as a benefit of membership, I think is a remarkable thing that we were able to do because of the kind of support that Arthrex gives AOSSM. And so I think that this is going to be a very useful tool. Already the feedback that I hear is that people are enrolling patients and finding some of the things that they're learning from this already is changing the way that they're doing things. Once again, I think that this is a great example of how now this type of technology, software technology, is helping to advance a critical thing that we need to do.
Neal, like other surgeons in the operating room, you have need for technology support, right? Things don't always go as planned, right? You need to have options in the OR. You need to understand how technology works. You need to overcome a technology challenge. And our technology consultants that are trained to be in the operating room every day to support surgeons and the staff, have been very valuable to you over the years. Can you describe your relationship with your local technology consultant and how important they are for you and your treatment of your patients?
The representatives that you have in the field for your products and the continuous updating, upgrading, and innovation that you have is an enormous asset. I find them to be the most educated sales force in the business. I know that you put a lot of time and effort into doing that and training them and educating them, but tell me again, how many thousand products did Arthrex come out with last year?
1,700.
1,700. So 1,700 new products. Even somebody like me that tries to stay up on the literature, and I'm involved with research and development of products, I can't keep up with all of that. It takes a sales force like you guys have here, and that's all around the country to support the surgeons, to show them what's happening, show them the new products, to help them develop the techniques to use the products to help their patients. And it's an enormous asset to have this well-trained force out there. So I love it when I see the Arthrex guys show up. I know that things are going to go well that day.
So Neal, you're a great advocate of using Ortho Biologics to treat your patients. Obviously, that's the least invasive treatments you can offer for your patients. Can you tell us what you've learned over the years in terms of what biologic treatments have been successful and what kind of outcomes you've had with your patients?
The issues that I see oftentimes is either acute on chronic injury with the difficulty healing of some of these soft tissues, or it's a failed completion of a healing response. And so you get problems like tendinosis, chronic tendinosis that remains symptomatic, painful, can lead to weakness and dysfunction. Or you have a difficult time to heal certain ligaments that we take care of. So that's one issue. The other is the early active arthritic athlete. and were developing degenerative changes in their joint that caused symptoms of inflammation.
Neal, you've been a thought leader for the treatment of the UCL injury for many years. Recognized one of the leading surgeons in the world for the treatment of the UCL. Recently, Arthrex introduced new technology, the internal brace, and you and Jeff Dugas and a few other leaders have implemented this technology to repair the UCL versus a reconstruction. Can you talk about your experience repairing the UCL versus a reconstruction with the internal brace, and how has it had impact on other surgeons at Kirtland and Jobe in treating some other different types of ligament injuries?
Yeah, the concept is an excellent one. How can you repair or reconstruct tissue and protect that healing repaired tissue or remodeling reconstructed tissue while you're trying to regain range of motion and strength and function? Those two things tend to fight each other and can jeopardize the healing of tissue or the remodeling of a graft. And so the concept of supporting it with taking some of the stress and strain that could be damaging to that healing and supporting that with a type of internal brace that's now been coined is very compelling. And people in our group and elsewhere in the country are looking at how to be able to brace a reconstructed tissue, repair torn tissue, and brace it while it's healing. I was mentioning earlier today, actually, one of my favorite Tommy John stories is the story of an athlete who actually is the first one ever to come back into Major League Baseball after not one, not two, but 3 Tommy John surgeries. And even he likes to say it was 3.5. But it wouldn't have been possible without the technology of collagen-coated suture acting as an internal brace to repair, in this situation, both a torn tendon and graft. So being able to support that, promote healing, protect the healing tissue, I think has a big future. And we're starting to see it, not just in the elbow. We're starting to see it in other places. We're starting to see it used in the knee. We're starting to see it used in the small joints of the hand, the thumb, which actually has been a huge benefit in a lot of baseball players coming back so quickly from UCL injuries of the thumb. And so I'm sure that we're going to see this having success many other places in the body, not just the elbow.
It's really a very important decision about who you're going to trust. What products are you going to trust? What company you're going to trust in terms of making the decision of what you're going to use to treat your high-end athletes better and get them back to their normal lives and to return to play. So why Arthrex? Can you tell us your feelings about that?
With what I do and what any surgeon or physician does with a patient, the success or failure, the ability to do it, relies ultimately on trust. And so that trust between the patient to me to put themselves in my hands is an enormous privilege and it's enormous responsibility. But nothing works without that trust. And much of the reason why they trust me is because, not just because they sense that I care, but because of the track record that I've built over a long period of time. Just as they trust me at this point, I trust the company that has helped me to do the things that I do over 2.5 decades to do. The evolution and the advancement of Arthrex is completely intertwined with my career and in doing what I do. And it all goes back to that philosophy, the search for excellence, for reliability, to consistency, and to providing me with the highest quality products and instruments that I can use on a daily basis. And to have somebody that is helping me and is working with me and is my colleague who their top priority, aside from all else that might be important to a company, but the top priority is to help me to treat my patients better. That's the trust that I have then with that company. So that trust directly affects the trust that goes on between my patient and me. So for that, I'm thankful that we've been able to work on these things together for this length of time.
That's great. Well, Neal, I really appreciate your time today coming to visit us in Studio 360. You know, we believe also technology does change everything in orthopedics, you know, and we're investing for our future, and we look forward to working with you in research projects, education, helping other surgeons treat their patients better. And congratulations on a very successful career, successful year, and we wish you all the best in the future.
Thank you, Reinhold. Thank you.